Tell me about acupuncture and introduce yourself.
All right. Well, my name is Betty Crescio. I am a licensed acupuncturist, and I've been doing this for a number of years. I attended East West College of Natural Medicine in Sarasota. I got my master's in Oriental Medicine there, got all of my boards, Florida licensed, and I just started my practice.
So why acupuncture and not just some other kind of practice?
Great question. That was a very long road. That wasn't something I decided really quickly. I would have to say that in my early 20s, I originally set out for a career in veterinary medicine and biology, and that's what I thought I was going to do. My early college career was interrupted by the loss of my brother, which meant that I took time off. So I got out of school to really think about what I might want to be doing, just reevaluate my priorities. And over the course of the next 10 years, I lost another 3 people that were very close to me. One to liver cirrhosis, which was due to being on too many prescription drugs for too long. It was my grandmother. And that would be when I first started to really question, all right, well, all of these medicines were meant to help her, but yet they ended up, destroying her liver, and that's why she's passing early. So I really started to question, is there a better way? And then a few years later, I lost a brother to veteran suicide. Again, he had gone to the VA for help and was just kind of overlooked. So I started to question again, why is our system like this? And then I lost my older sister to breast cancer. She had been fighting for 14 years. And in the end, the cancer is not what killed her. It was overexposure to radiation and chemotherapy that had destroyed her organs' viability. They just couldn't function anymore. So again, I had to question, why was her treatment what ended up taking her life, not her disease? So I just thought there has to be a better way. And among some of my research, that's when I stumbled onto East Asian medicine, and I decided to pursue it.
I love that. And you're right. There has to be a better way than the traditional system, which is killing people. You brought up the VA. When I was in Argentina, I met a lot of former soldiers who had mentioned that they turned away from the VA because all the VA did was give them pills. And that's terrible. So to transition, can you explain what acupuncture is? And can you walk me through what a treatment would look like?
So acupuncture is well over 5,000 years old. It started in ancient China, and they have just learned through empirical evidence and lots of trial and error what could work, what doesn't work. And to be honest, mechanically, we still don't have the scientific terms to describe how and why it works, but the empirical evidence is there. There are research studies being done on it all the time, and new information is always being gained. So there's always something new to learn. But in a typical treatment, you would go through a rather extensive interview. Unlike some traditional Western medicine, you would go through your entire history of your lifestyle, your mental and emotional state, your diet, and it's about an hour-long interview, and then you would proceed with your treatment, which could be about 30 to 45 minutes.
So what about someone like me who's afraid of needles?
That is a common occurrence, and I can't lie, I'm no fan of them either. But they are really fine. They are probably the size of a cat whisker, if not smaller, and you will barely feel a prick. If anything, it might be like getting bit by a mosquito, or you may feel nothing at all. So it's very gentle.
Awesome. And so, given your client base, what are some of the issues that you see most often?
We see a lot of pain that come through. The biggest thing that we see come into the clinic is usually people who are tired of just being on prescription medicine and they are looking for an alternative, or they've been to a number of Western medical doctors for a given issue and they just keep saying, nobody knows what's wrong with me. or they can't give me any answers. Can you help me? Those are the people that walk through the clinic the most. But we're great for a number of things. We can treat anxiety, stress reduction, insomnia, digestive issues, headaches, aches and pains, and pretty much anything.
So something that's a little bit outside of the box that you said that you help with is corporate burnout. So can you explain what corporate burnout is and how acupuncture can help with it?
Yes. So corporate burnout is usually a state of overwhelm because we've been under sustained stress for so long. And basically our sympathetic or our fight or flight system has been turned on so long that your cortisol levels are through the roof. There's usually high anxiety, high stress levels. There may also be some insomnia or just very elevated levels of irritation. It happens to the best of us. We just don't get a break because it may be we have lots of deadlines or an annoying coworker or, a number of reasons. So acupuncture can help by trying to stimulate that parasympathetic nervous system, which is linked to your rest and digest. A lot of our acupuncture treatments, some studies show that they believe it helps activate the vagus nerve, which is, again, strongly correlated to the rest and digest nervous system. So we try to help you relax and just kind of calm down and give your whole body a chance to just relieve itself.
Wow. And then how does it work when it comes to cortisol levels? Is that the same process?
Yes. So cortisol, as long as you're in a relaxed state, it would hopefully also help naturally lower those cortisol levels, since cortisol is naturally elevated when your fight or flight is on.
You are in Florida, correct? So why did you pick Florida and wanted your practice to be in Florida specifically?
I was already here, so I don't know that it was so much of a conscious choice as one that was more made for me. It's mostly because in the state of Florida, I can do homeopathy, I can do herbs, I can even do injections, but Florida gives us the greatest scope of practice.
So can you expand on that a little bit? Like why is it that Florida has such a larger scope compared to other places in the United States?
I would imagine because Florida in general has a higher level of regulation on a lot of industries, not just acupuncture. I have a number of friends that are in, accounting or engineering, and they all say that when they've come to the state of Florida, there's always been extra hoops for licensing industries here in Florida. So I don't know that it's specific to acupuncture, but yes, and the only other state that has as high of or as stringent of regulations as Florida would be California.
So the age demographic in Florida, and you're in Tampa, correct?
Yes.
So the age demographic in Florida, it tends to be people that are a little bit older. The stereotype of Florida is that it's a place that your grandparents go to retire. Given the scope of your work, is there a demographic that you particularly target, or do you go for everyone? And how have you seen that in your practice? Has it been more of the baby boomer and the Gen X generations, or what's the demographic, obviously, that you can give? I know with HIPAA laws, there isn't much that you can explain on that.
So I would say Florida is very mixed in terms of demographic. I think that the fact that it's just a geriatric community is a little outdated. Especially in major metropolises, we're going to be definitely a younger crowd. Maybe more in the rural areas. There are a lot of 55 and over communities down here specifically, but I would say that we're pretty evenly mixed in terms of who actually lives down here. But I would say I would treat anyone. It doesn't matter the age. We typically do see more geriatrics come in for treatment, but we also see people of younger demographics that are coming in for preventative medicine or pain. So, which is great.
Definitely, especially, in Tampa, you have the Tampa Bay Rays, you have the Tampa Bay Bucks, you have Tampa Bay Lightning. So obviously that's a lot of pain. And then when it comes to corporate burnout, you have, that demographic of everything from millennials and Gen Z that are trying to get into workforce or that are in the workforce that definitely would use your services for corporate burnout. Given what you do with corporate burnout, would you say that that's a niche that you are in, that you don't find that other acupuncturists are in this industry or in that specific niche?
No, I don't think that there are a lot of acupuncturists that are focusing on corporate burnout or anxiety. It's not that we can't all treat it. I just don't think that there are a lot that are focusing on it. People typically see us as treatment alternatives for pain, but that's kind of pigeonholing acupuncturists a little bit. You're not really seeing us for all that we can actually do.
100%. I feel the same way when it comes to chiropractic, right? When people look at chiropractic, they just think back pain only, but it really is a smorgasbord of things that it can help with. So just to transition to traditional medicine versus Chinese medicine. And obviously you would say that there is a use for both, but how do they differ?
So I would say that it's a little bit about comparing apples and oranges. They both treat very well, but they do different things. I would say Western medicine still has a purpose, and it's very great at treating acute issues that come up as emergencies like surgery or severe illness. That's where it shines, because that's where you want instant, fast treatment. East Asian medicine is going to be better at prevention because it is slower acting. So it's good for prevention or chronic issues and just long-term use because it's less caustic. I think it was Benjamin Franklin who said the famous quote, "An ounce of prevention is worth a pound of cure." And I think in general, people don't look at their healthcare as a form of prevention. They're always looking for the cure after the fact rather than trying to prevent the issue from occurring at all. So I think healthcare in general should shift from aftercare to preventative care. And that's a very hard mentality to work against.
100%. And that's the reason why we made the platform in the beginning, was because we wanted to introduce preventative medicine and showcase to the world that alternative medicine is not really what it is. It's actually preventative medicine that can help with diet and lifestyle and prevent you from having to incur all of the costs that come with healthcare and really put your health into your own hands. So I love how you answered that and really broke down the difference, because a lot of times people look at what we're doing and they think, oh, you just want to get rid of traditional medicine. No, we do not. We want to put the power back into people's hands so that they can live longer and more sustaining lives where they're not dependent on traditional medicine. So,
Right.
How would you like to expand on that?
I think that there is space for traditional Western medicine and East Asian medicine to work conjunctively because they shine in different ways for different reasons. Again, Western medicine is best for acute and emergency situations, and East Asian medicine would be better for chronic and preventative long-term issues. So there's definitely room for them to work together.
100%. So I seen on your website that you do homeopathy. So how does that work in conjunction with the acupuncture work that you do?
Well, acupuncture in and of itself is considered a vibrational medicine, which is no different than homeopathy. But for me, it's all about patient compliance. We had talked earlier before that when I've had herbs or Western pharmaceuticals, especially for my children, that they're not very keen on taking them simply because they taste bad. So for me, I have a much easier time getting my children to accept homeopathy. And if it's to get them to be better, then I'm going to have to go with what they will take versus what I have to fight them to take. And I completely understand, because I myself am not always very compliant with just even remembering to take my nutraceuticals, because it just may escape my memory sometimes. But homeopathy can be very effective. But unfortunately, its drawback is that you do need to take it in increased frequency, because it is a much gentler medicine compared to herbs or Western pharmaceuticals. So by nature, the gentler the medicine, usually the more frequent you need to take it or perform it, simply because that's what's necessary to get the compound effect.
100%. I really like how you explain that. So just to close, what message do you have for the city of Tampa and why they should utilize acupuncture?
I would say that please see an acupuncturist. It doesn't have to be me, any acupuncturist, but that, we can only make small corrections in our health 10 degrees at a time, turning the boat, and hopefully we'll be in much better, different places down the road in our journeys than if we continue down the path of just traditional allopathic medicine, which can still be very caustic if taken in excess or without true understanding of what its side effects could be. I encourage campaigners to do their research and explore all forms of integrative and alternative medicine and find what works best for them. It may not be acupuncture, it may not be herb, but it may be something else, whatever works best for them.
100%. And where can people find you? Can you want to mention your website and your office?
I am on Instagram at Ocean Trace, and my website is also oceantrace.com, and that's TREIS for trace.
If you're in Tampa, Florida, needing acupuncture, visit Ocean Trace Medical. We provide expert acupuncture treatments designed to relieve stress, reduce anxiety, and restore balance. Our holistic approach goes beyond temporary relief, helping you achieve lasting calm, better sleep, improved digestion, and overall well-being. Think of it as a reset button for your mind and body so you can feel more grounded, energized, and at ease in your daily life. Visit oceantrace.com for more.